I feel pretty lucky. I was joking with one of my coworkers a couple of weeks ago that if you had told me 10 years ago that I would be working at the courthouse 3 days a week, I would have laughed and thought there was no way. It's cool walking into the courthouse and not seeing my name on the wall on the docket sheet. Never would have believed it. And yet, here I am. It's pretty cool. So what brought me to the center was my constant battle with my alcoholism and my addictions, where I had succeeded and failed so many times, but it got harder and harder every time, as it does. And I started hitting meetings every day when I got out of the hospital. And I got a recovery coach, a therapist, and AA. Those three things were the three barriers I put between myself and my next drink. And tomorrow, I will have 2 years. It's really hard. I never, ever would have, this is my hometown, and I never would have believed that we would have unhoused people here, that we would have fentanyl, methamphetamine, all of those things that, from my experience, go along with a big city kind of thing, but in a small town in Vermont, never would have imagined it. And yet here we are.
Vermont is one of the states in the country that has been impacted the most significantly by the opioid epidemic, in large part because we're a rural state, and there are lots of places in our state that are very poor and isolated.
I would say the majority of the calls where people are calling for some kind of a police response involve some type of substance use. So it has a big impact on our community. Some of my experience is that the public thinks that law enforcement can just arrest them, force them to get help, and that's going to make things better. Addiction is a disease, and it's not something that we can arrest our way out of. And centers like Peer Recovery Center of Addison County are very helpful in giving us a resource as law enforcement to provide to people in need.
Law enforcement, medical providers, support services like the center, peer recovery coaches, all of these people are really important to helping somebody get to recovery without making it something that is a criminal offense to say, I need help.
So we are that in-the-moment support where people can walk in and say, I want to do something different. And we can try to help them access those in the moment when they're ready to make that change. There is no fee for recovery coaching or group or any of our activities. Everything we provide is free of charge. When we have flexible supports for people that are struggling, they can get what they need and they can walk towards a path of gainful employment. They can walk towards a path of finding housing, being able to pay for their own food. At some point, having medical insurance, right? So we're giving people a way to move forward, and we're also building a healthier community where less people are reliant on state and federal systems.
The state legislature's come a long way in recognizing how important that is to have people who have lived experience with recovery, and making sure that those are the people that are on the front lines of helping people who are trying to get to recovery.
So we often get confused with, counseling or clinical services. And it is different because all of our staff is leading with previous experience, whether it's their own substance use or other addiction or family members. They're all leading with that.
Occasionally I'll get somebody who will say, well, what are your credentials? What qualifies you to do this? And it is interesting explaining my lived experience is my credential, that is my education.
My name is Allison Robinson. I am the supervisor of the recovery coaching program at the center. I also do a parents in recovery group that is partnered with Prevent Child Abuse Vermont. I met Tara, it was probably a year ago.
When I first came to the center to an AA meeting, my life was a complete mess. I struggled with an opiate addiction for years and got myself sober. I was sober for about 7 years, and my life took some turns, and I had a lapse. My child was taken from me in DCF custody, and I started working towards my sobriety and towards getting him back.
We then transitioned into working with Tara's family in support of Tara regaining custody of her son.
I think I was struggling a lot emotionally, not having my child over a year ago. I didn't know who I was anymore after being out in the world of addiction. I think I've come a long way. I have a strong sense of myself. I regained custody back of my son, and that is great. I think Allison coming in and working with not just me, but my family as well, has helped strengthen our family system, strengthen our communication. There's a huge difference. They understand more what I have been through and what I continue to go through.
Sitting across from somebody who has been there and really understands it is paramount to recovery. The compassion and the understanding. That's what it really boils down to for me, is the understanding. Because if you haven't lived it, you won't get it. But with the support and help from people that have been through it, that's it. It's the key. I should definitely be dead like many, many times over. So that's a gift, and it's a gift that I feel it's important to share. Yeah, this place saved my life.